This video is going to talk to you about interpreting your score in the Archer Review QBank. So I have just finished a learning assessment, and this is the screen that I see as soon as I submit the test. The first thing you'll note is your average peer score, and then your score. So what is this? The average peer score shows the percentage correct that students got on the exact same questions that you answer. That's why your average peer score is going to be slightly different depending on the batch of questions that you received. Easier questions have a higher percentage of students that get the correct answer, and harder questions have a lower percentage of students that get the correct answer. So the average peer score on this set of 75 questions in my learning assessment was 51%. Now we come over to my score. My score was a 53%. So I was able to do a smidge better than the average person did on this set of questions. Now, based off of that, our software has calculated my chance of passing. And this is really what I want to pay close attention to. My chance of passing is high based on the specific questions that I took and how I was able to perform compared to my peers. Now, I know this seems a little funny. I mean, if I got a 53% in nursing school, I would have failed. But that is not how the NCLEX is graded. It doesn't look at the percentage you got correct. It simply ranks how many questions you were able to get against what your peers were able to do. So the passing score, what results in a high or a borderline or a low, will be slightly different for each and every learning assessment. There can be a lot of confusion based around that, since a 53% might not result in a high chance of passing for each and every learning assessment. So again, it depends on the specific questions you took. And you can see all of those specific questions in your test review. That's the screen that we're looking at right now that we saw immediately after submitting our learning assessment. If I scroll down, you will see each question, the ID number tied to that question, the subject of which that question was in, and the lesson. Next, you'll see the percentage of your peers that actually got that question correct. So this tells me if that was an easy or a hard question. If 81% of my peers got that question correct, it's a pretty easy question. The higher this number, the more of our peers that got that answer correct, and the easier it is. The lower the number, the less of our peers that got that question correct, and it was actually pretty hard. Your test review allows you to sort from hard to easy questions by just clicking this button, Percent Correct Peers. Now it's ranking from hardest question to most easy questions. So this question right here from the child health subject on the growth and development lesson, only 7% of my peers were able to get it correct. And you see that I did not get it correct. This is a very hard question. If I sort the other direction, right here, 99% of my peers got this question right from fundamentals in the basic care and comfort. So this is a very easy question. I got it wrong, and I really should be concerned when I get questions wrong that 99% of my peers are able to get right. I like to sort the percent correct peers in this direction, with the easiest questions at the top. I can then scroll down, and if I see a question that I've gotten wrong that most of my peers have gotten right, I'm really going to want to review that. So I can click on that item and go see what in the world I did wrong. As they get harder and harder, I might be getting more and more of them wrong. Around 40% is where I want you to focus. Anything that 40% or higher percentage of my peers are getting correct, I want you to make sure that you are getting correct too. Of course, if you're getting these hard questions correct, that's excellent as well, but you shouldn't be focusing your energy on questions that only 18 or 15% of your peers were able to get correct. If you're still not getting questions correct that 99% of your peers did correctly answer. So this lets you see what to focus in on and how well you're doing. As you all know, you need to receive 4 scores of high or very high consecutively in order to be ready for your NCLEX. Now, when I say consecutively, I don't mean that you have to take them back to back in the same day. In fact, I really do not want you to do that. I want you to take a learning assessment about every 3 to 5 days or as indicated by your tutor, and each of them 4 times in a row should be high or very high. If intermittently you're getting low and borderline scores, you're still not ready. So that's your test review screen. And there's a button up here, Test Analysis, that I want you to click on to give you a breakdown about the different subject and lesson areas that you got questions about in your learning assessment. Here we can see the percent correct, incorrect, and omitted. You shouldn't have any omitted. You can also see information about when you changed your answers. If you changed it from correct to incorrect, incorrect to correct, or one incorrect to another incorrect. If this number up top is especially high, correct to incorrect, I want you to stop changing your answers. Don't go back and review the question and change your answers again because it's really hurting you. You're changing your answers from correct to incorrect. So pay close attention if that first number is high. Now I see the different areas of my test broken down by subject. I see in adult health, I had 14 questions correct and 13 incorrect. So about 52% correct. It's okay, not so great. I'm still in the orange, so I need to do a little more review here. Child health and fundamentals were my worst area, only 43 and 40% correct respectively. So I might need to go into tutor mode and do some tests specifically in the child health and fundamental area to help get my scores up in that section. Critical care was the only lesson that I really did well in, where I got 100% of the questions I took correct. To break it down even further, toggle over to lesson, where you can see super specifically what you've done well and what you haven't done well in. Cardiovascular could really use some improvement for me, as well as medication administration. But I did pretty good with assignment, delegation, ethical and legal, and management concepts. So this gives me some really specific feedback about some areas that I might want to go do a little bit more study in. To get back to the overall test review, click Review Test. You can review every single question that you took. You can see the answer rationales, and I want you to go through these. I really do. We have lots of in-depth information in those answer rationales. Take notes, add it into your rapid prep handouts so that you can benefit from this knowledge. You can close that out, get back to your general test review screen, and review your chance of passing again. So I hope this video helps you understand what your average peer score is, your chance of passing, and will give you some guidance in reviewing these scores as you prepare for your NCLEX.